I think experience is the first way to select a surgeon, but how to know if this surgeon has experience or not? In Mexico, we have the Mexican Council of Bariatric and Metabolic Surgery, which is Colegio Mexicano de Cirugía de Obesidad y Enfermedades Metabólicas. And you can have some information there. You can have as well information from the hospital, and you need to find surgeons that are working in a good hospital that is it has at least one certification, like Joint Commission or another certification, even Mexican certification, are a good way to know if the hospital is a good hospital. My recommendation to go back to work, it depends on the usual activities of patients, at least 7 to 10 days. The advantage of this is that we do all the surgeries laparoscopically, and that's why we can release the patient earlier to go back to their regular activities. If they have to do something like that is related with heavy exercise or heavy lifting, they might wait at least 6 weeks. Talking about sugar or artificial sweeteners, we have several articles talking about high glycemic meals or sugars. That means that when you eat something with high sugar or high glycemic sugar, you have like satiety in the next 15 or 20 minutes. But after another 20 or 30 minutes, you get really hungry, because the high glycemic meals or food will decrease or make your blood sugar drop, and that will make the insulin level in the blood increases, and this increase in insulin will make you feel really hungry. So it's better, sometimes when this starts to happen, we must make the patient eat from 5 to 6 meals a day, especially having some protein in each meal. You need to choose which is better. I prefer artificial sweeteners because it's most likely to have more hunger after having carbohydrates, especially regular sugar. Well, constipation is happening like 20 or 30% of patients. It has to be with decrease in food intake, but it has to be as well in decrease in water or fluid intake. So it's very important for patients to have enough fluids. How much is enough fluids? It's about like 2 or 3 liters of water a day. And if the patient previous of the surgery have constipation, maybe at the beginning they might improve their condition, but after a few months they will go back and need their regular medication to treat constipation. After any surgery, we must keep watching patients for long life, at least once a year, and especially the surgery that is it has malabsorption involved. We must have certain workup, like lab workup, like complete blood count, comprehensive metabolic panel, and certain vitamins like B12, B1, and we must track that. So if, as I said, malabsorption is involved in the surgery, we must keep tracking these lab exams at least once a year for lifelong, and vitamins and minerals are mandatory for lifelong. In the case of the sleep, there are around so far from 10 to 50% patients that need to have vitamin B12 and iron for long periods of time, more than 5 years, because of anemia and lack of absorption of these nutrients. So in the case of the band, we must keep tracking, especially the whole device. We must watch at least once a year on an upper GI or endoscopy to see if there's any complication or not with the band, especially looking for slippage or erosion, which are the more common complication of this procedure. Dumping syndrome is the fast emptying of the stomach. Moving the stomach content rapidly to the small intestine. The small intestine is not ready to handle a high pressure meal inside. And what happens is that certain amount of fluid comes from the small intestine to the inside of this, and that can cause dizziness, dropping in blood sugar, dropping in blood pressure, nausea, abdominal cramps, distension, or diarrhea. You can have either like a single symptoms or all together, and it's related especially with fat and sugars, regular sugar. That's why we ask the patient not to have too much or not to have regular sugars. It's most likely to happen in gastric bypass, but it might happen with sleep. Around 10 to 15% of sleep patients might have dumping syndrome. The best way to avoid this is to have small meals and not too much fat and not regular sugar. Carbonated beverage. We try not to use them after surgery because it enlarges the pouch with the gas, and that might create like a bubble inside and make the patient feel really bad. Certain patients are able to drink carbonated beverage after a few months, 4 or 6 months after surgery, because they try to release the gas of the beverage, and sometimes they dilute a little bit with water, and that decreases the symptoms. But it's better not to take them because you can enlarge the pouch a little bit, and that's the opposite that you want, because if your pouch gets enlarged, you will be able to eat a little bit more, and if that happens, you will you will gain a little bit of weight that you don't want. You really don't want. Talking about alcohol is it will depend on the procedure. Especially gastric bypass, it will absorb faster, and you might feel like with less tolerance of alcohol after gastric bypass. As well, you might be able to have more chance to have any liver complication if you drink too much. Is allowed, yes. Sometimes you can have one or two social drinks a week or every other week. But sometimes patient changes or increase the amount of alcohol because they are not able to eat too much and they drink too much, and alcohol has a lot of calories and might create ulcers or might create problems in your small intestine. So if we are talking about alcohol, it's not to quit, but it's very important for patients to drink very small amount of alcohol. There's this article from this doctor in LA, Morton I think is his last name, and he made this test in patients. He gave the patient before surgery a glass of wine, the same amount of wine every patient, and they drink and they do the alcohol test with the blood test. I don't know how to say that.
Breathalyzer.
Yeah, breathalyzer. Okay, so no patient has any problem after that. 2 months after surgery, he gave the same amount of wine, and most of the patient has legally intoxicated after the same amount of wine after the gastric bypass. So you will absorb the alcohol more than before, and that might lead to problems in your liver or any other problem.